how important is it to take care of the whole person? We talked about, the key piece being pain management and making someone comfortable, but, there's an element to this that's mental, that's spiritual, that also needs to be addressed, right?
Yeah, Jason, you're exactly right. The person, when you break a person down, you have the physical part, but after that you have the spiritual part, you have the psychosocial part, as we call it. You're a part of a community, and when illness happens and it affects your family, a lot of these things change. It's not just that someone is so sick there and they're not going to get any better, but also you're a caregiving. Maybe you've never been a caregiver before, and so now, instead of being able to go out whenever you want to, your assignment is to care for your loved one. And even though you want to, it causes a lot of stress on you and your body. So this is why we use an interdisciplinary team. This is why we have a chaplain, we have a social worker, we have a nurse, we have a doctor who come into your home and help you. They set up visits according to what you want. And essentially, there's some people who are in their 80s or 90s who need something every day. And so we're actually seeing them every day. But it's at the end of the day, when pain is taken care of, most of it's about, what did I accomplish in my life? What legacy am I leaving for my family? Is there anyone that I need to say I'm sorry to, or to ask for forgiveness, or that I love them? What do I need to get done, and kind of making up that list. And so hospice is there to help people with that, and make plans. Some it's young families in their 40s who are saying, let's talk about, the college fund for the kids, because I'm not going to be here for that, and how do we get to that?
Many, many different moving parts to this, right? And as you talked about, there's that part of it, and there's also the piece of coordinating with other doctors, other caregivers, medicines, equipment, etc. How have you developed a plan to manage all of that stuff and basically take that off of your patients' plates?
Well, we do a lot of strategic partnerships. We work with every hospital that is any hospital that our patients would go to, we work with them. Some of them, we actually have doctors assigned to that hospital, so they are referring their patients before they leave the hospital to our services, and whether they you might need hospice, or you may need palliative care, because we do a lot of palliative care. So we serve 1,200 hospice patients a day, but we serve probably that many in palliative care, which means that they're not quite ready for hospice care yet. So hospitals will let us know who might have pain out of control or symptoms out of control, and they need our special expertise to address that. So we actually have someone in the hospital, they call the doctor or the nurse practitioner, go right to the bedside while they're still in the hospital and before they leave. And so families really are less worried about the unknown when they get home, because they know they've already met us. They know what we are promising, and that we're going to meet them at the house, and we're going to get equipment there if it's needed. The medication's going to be there, and we're going to stay and help administer that until it's okay to leave. So one of the other things that's phenomenal about Capital Caring is that we do have these inpatient centers. We have the Adler Center for Caring, which really is a state-of-the-art facility that opened last September. And it's in the Western Loudoun region, because those patients were, they did not have an inpatient facility accessible to them. We also have the first hospice inpatient unit in the country at the Hallquist Memorial Inpatient Center, which is nestled in a neighborhood in Arlington. It was an old schoolhouse at one time, and most of the older professionals across the country probably learned how to do inpatient care at that. It opened in 1982. And then we have a couple other projects that are forthcoming, one in the district and one over in Prince George's County, that we're really excited about. Because sometimes everything can't be done at home. So this will be a hospital for hospice patients, if you will, so that they can get that level of care, but by seasoned professionals who understand the needs of the person with advanced illness.
And beyond these initiatives, of course, of caring for the patient and managing all of the administrative tasks that come along with that on a number of levels that we discussed, you're also active in the legislative community. I understand that you were on Capitol Hill recently to meet with a key group of senators on the Care Planning Act of 2015. Can you tell me how that went and the response that you received?
Right. I think it's one of the obligations of being the hospice and palliative care organization that's been here the longest in the area is to make sure that our representatives, and all of our representatives, Maryland, DC, Virginia, West Virginia, that we keep them aware and abreast of any changes, anything that we can think of that would help get our work done more efficiently and more effectively, and certainly always help patients and their families. And they all have patients and families, so they totally get this. So it's wonderful to share and hear their stories and to tell them what we're doing, and they're very proud of what we're doing. But also just to say, this is something that knows no, it's very bipartisan. It doesn't know any political party. This happens, no one escapes this. If you live long enough, unless you die of an accident, everybody will, have some illness someday, or someone in their family, or know someone, or marry into a family. And so it really is a universal experience and a shared experience. And so people really get that. So we had no pushback whatsoever. Everybody was in, and we spent a lot of time on both sides, the Senate and the House, and we got good progress and from both sides. And so that's really, it's really inspirational to see, because we hear about all the times when they're not doing that, of course. And so when they are doing it, I think that it's really, really wonderful. And many of them, of our representatives, have had personal stories. Senator Mark Warner, Senator Rockefeller, Jay Rockefeller, and Susan Collins, Shelley Moore Capito from West Virginia, a new senator, actually just had both of her parents within the last 18 months receive hospice care in West Virginia. So talk about where do I sign? She was, stepped right up for that. So I think that they're very open to advances, but they're also open to hearing the difficulties in getting our work done. And that's important too, because there are things, red tape and other things, that sometimes get in the way. And at the end of the day, we have someone who's very, very ill, and they need help. They're entitled to good care. And so we are just trying to give the best quality care available in Virginia, Maryland, and Washington, D.C.
As you look ahead, where will your focus be, and what do you think the future of hospice care looks like?
Well, I think that there is a bright future for hospice care, because it doesn't seem like people are going to not need us anymore, because the numbers keep growing. But I think there are many efficiencies that would make us more effective as a state and as a region. And so I think that you're going to see more groups working together more collaboratively. So, ours is a community-based independent program that is probably one of the top 5 in the country, nonprofits. So I would think that you would see other nonprofits regionally starting to work together, saying, where can we have some economies of scale? Where can the efficiencies, come from, so that we can conserve and preserve and give our families more, because they need more as technology gets further and further along. We need to be able to keep up. And the customer, it's not your grandfather's hospice anymore, if you will. It's a new patient these days. They get things off the internet and they know more, and it's wonderful. And so really, when you cross that threshold into someone's house, they're expecting you to be the number one expert in the care that you're giving, and they should. And that's what we're dedicated to every day, is to make sure that we're that expert. So it takes a lot of study, it takes a lot of learning. We have some core values that we live by. We are both learners and teachers, so we read a lot. We have national experts who come into our space, our offices, and teach. We use and actually wrote a book, The Hospice Companion. Each of my physicians took a chapter, and then it was edited by a national expert in pain management, Dr. Perry Fine, from the University of Utah. And so he comes here about every 2 weeks, and we really go deep on the science, and so we try to figure out what's the best way, what's the best approaches, and then we are not selfish in keeping that knowledge. We wrote 8 papers, research papers last year that were published in medical journals, and so we're always putting it out there, how to do this better, so others who may live in more rural areas, in Virginia, West Virginia, Colorado, we don't care where, so that people can emulate things that we found to have really good outcomes and work, and patients and families seem to like it.
I'd like to thank my guest today, Maylene Davis, President and CEO of Capital Caring. For more information on A Capital Conversation, visit WTOP.com and search Capital Caring. I'm Jason Fornicola.